Dizziness. Now, I get car sick. I can get dizzy, like sitting in a lounge chair if I go back too far. I mean, I can get dizzy a lot. Just sometimes it'll come on just standing, walking too much.
Well, that can be several things. In the car, I mean, there are some people their balance mechanism is just weak.
Yeah.
And they say, oh, ever since I was a kid, I get car sick or I get seasick.
Right.
You go on a boat, you always see those people wearing those patches because that tries to correct things, and they help pretty much.
Right.
When you put your head back like this, it's possible little blood vessels that go through the spine to the brain. Everyone talks about the carotid arteries. They get a lot of press. There are also little blood vessels in the spine. And when you go like this, if there's any arthritis in the neck or any stiffness, you can pinch those off. And a lot of people say when I go to get my hair washed, they put their head back and they get very dizzy. So maybe a couple of things that are causing it. You get more than wisdom with age is what I'm saying.
I think you get everything with age.
What other questions? Yes?
I'm going to harp on what I said before. You got 2 sets of this stuff. What's in the middle? What is the...
Some people not much. Well, you know...
Where did they join?
In the brainstem. Let's go back to that MRI. Remember that we showed how the inner ear structures, the nerve that then goes into the brainstem. In the brainstem, oh, that's what the neurologists do. When it's not coming from the ear and it's something in the brain, there's a complex connection from left to right. One of the tests we do when we're studying balance, they worked it out over 100 years ago. There's certain temperatures, which I mentioned before, when someone flushes the ear can make you dizzy. We take advantage. When you hit someone's knee with a reflex hammer, the message goes up to the brainstem, a reflex comes back down, and the leg jumps. Well, there's a similar thing in the ear, but instead of a hammer, we use warm and cool temperature, either air or water. And they worked out exactly which warm and which cool is perfect temperature for this. And when you put that in the ear, it stimulates the balance mechanism, sends a message to the brainstem, and there's a reflex that comes back, and it actually goes to motion of the eyes. So if you watch people's eyes when they get really dizzy, sometimes you'll see nystagmus. You'll see the eyes jumping like this. And there's some tests we do in the office when we're evaluating dizzy patients to see if that happens abnormally. But we actually use that reflex when we're studying the balance mechanism to see if when we turn the key, does the engine start. Okay? This is not an easy thing to grasp. You guys are doing great. Because dizziness is like always the worst thing to talk to the medical students about.
Well, we're Dr. Green's patients, so what do you expect?
That's just what you said. Yes?
I got, everybody talking, I get car sick. Also balancing. I cannot walk across the lawn.
Probably more of a neurologic thing.
And I never could. I was in the Army. We're going through the final phase of basic training. 200 guys walked across the log under a muddy pit. 2 fell in. I was one. And
Who was the other?
I don't
Repeat.
think it was him. So
It's probably, you know...
I feel like I try too hard sometimes.
I mean, probably, and some people can play basketball great. I was never one of them. Some people can balance. Look at these jugglers. Look at these people.
I hate those people.
Yeah, I know. I like you. But you know, we see that some people are just clusters. You know, the balance is just not great. Not to say anything negative about you, but
well,
but it's more of a neurologic thing. It doesn't mean there's something wrong. It's just that not everybody. Some people, they're born, they don't hear great. You test their hearing, and it's just not where the norm is, meaning where the majority of people at that age should be. On the other hand, I have some people come in and their hearing is better than the norm, better than when the majority of people would hear. So it's just, you know, who's to say where you're supposed to and have that faucet on? Unless that log is over by Joe's Bar and Grill, maybe that's why. Yes?
Why do people, as they get older, think they have trouble discriminating voices in conversation in
A crowded room?
A crowded room.
That's a good question. You know, when we look at, I wish I had a copy of the hearing test here. The most common hearing test we'll see when someone has a hearing loss, the pitch is up high. You know, we look at pitches like on a keyboard of a piano, low notes up to high notes. All right? Most times the low notes hold out okay. The part of the inner ear, the cochlea, that seems to go with age is the high pitches. They drop out first. Well, when we look at speech, speech has a kind of a defined area where one-on-one speech, you don't have to count on the real low notes, you don't have to count on the real high notes. For one-on-one, we just have this little area here that you'll do all right with. If you look at the frequencies that come through a telephone, they're not for full spectrum. They're not like 20 hertz up to 20,000 hertz. They're a small little spectrum. But that's why the quality is not that great. But one-on-one speech will do okay. When you're in background noise, like you're in a restaurant, and one person is talking, they're competing with that whole crowd for your ear. Well, your ear has to somehow start looking for cues in that one person's voice, saying, I want to be able to decipher that, pull that voice out of the crowd. All right, I'll look for overtones in that voice. Well, overtones fall at a high frequency, a high pitch. Well, overtones also fall at a low volume. And if anything, that's the part of the hearing of most people that drops up at the high end. So they don't have that mechanism to pull that cue out, the overtones. So they can hear that one person speaking, they just can't figure out, I wish they would speak louder. I wish they would, well, that's what they need. They need those high pitches up louder. That's why the old hearing aids, which had the microphone, the amplifier that turned everything up, and the speaker, the most common hearing loss, that you could hear the lows but not the highs, you turn it up, you turn this as much as you could to get the highs up, but you distorted this. Then along came digital technology. Now we can turn the lows up not at all, turn the mids up not at all. It's like almost having a graphic equalizer. Say, oh, this guy just needs these high pitches turned up. We'll turn them up. And then they feed it back into the ear as regular sound. That's why now, what used to be the hardest hearing loss to aid is easy. And if I took a hearing aid that were programmed for this guy's ear, and I put it in my ear, it would sound really odd. It would sound like everyone had a lisp, because the high pitches are turned up. And I wouldn't need that. So they're really tailored per person.
I guess my question is to follow up on what you're just saying, would a hearing aid actually make it easier to hear?
Yes. You know, it's interesting. I look at these hearing aids, I don't know why they cost as much as they do. You know, there's got to be collusion out there or something, because they cost a fortune. And as I buy my kids these iPhones and iPads, and I see what we pay for them, hearing aids cost more than that. And there's plastic things with, like, who knows, you know, almost nothing inside. But the digital technology, yeah, and you pay more for the bells and whistles. Like, you know, do you want this hearing aid to work more to filter out certain things if you're in a room with a lot of echo, a room with a lot of background noise? So different bells and whistles you can get on different hearing aids. But they really do make a difference. I mean, the technology, just in my years in medicine, has gotten so much better. Not just the cosmesis of them, where they're almost not visible, but they work much better.
And the thing I don't understand is my hearing seems to be fine. I can hear it all the time. Things happen throughout the office, but you get me in a room full of people. I mean, I have to get real close to them. I want to hear them.
I bet you have a high frequency loss.
Yeah.
I bet you do, because that would be the most common thing. To the point when a patient comes in and tells me that, in my mind, I think when they come back from their hearing test, I know what it's going to show. And 9 times out of 10 it does. Yes?
Yeah, when I'm still resisting getting hearing aids, both my parents
Oh, I would
ended
have
up
known you were,
with
now I would have known you were from Chicago.
programmable hearing aids, you know, so they could turn
Yeah.
themselves up and down and all. But when I went in for a hearing test, the technician said, were you a pilot? And I said, uh-huh. She said, I thought so, because there was a notch in the soprano range. I don't hear women's voices real well.
When we look at the hearing spectrum, you know, hertz frequencies all the way out, there's one part of the ear, 4,000 hertz, which is the most sensitive to loud noise exposure. Either one firework that went off by your ear, or cumulative over time. The answer on the exam would be, which one of these hearing tests is most consistent with the guy who worked at GM and didn't wear earplugs? It would be the hearing test you have. Very classic. You see everything looks the way it does, and then there's this dip right at that one frequency. And that seems to be the part of the cochlea, remember the thing that translates the sound wave to nerve language. It's the most sensitive to loud noise exposure. So we can usually tell when we see a hearing test like that, so I bet you work for a factory, or oh, I'm a hunter. And we look and we see that the ear that's closest to the muzzle of the gun has that same notch right there. Anything else? Thank you very much.
Thank you.
Good.
Thank you very much. What's that?
I don't know if I like that.
Well, we won't put it anywhere if you don't want us to.
No.